So our question to answer today is, how do you change Medicare supplements if you don't want to answer any health questions? Well, I'm Joanne from Get Set Up, and we're going to talk about that today. In order to change Medicare supplements, first I want to do is back up and explain what that Medicare supplement is. So remember, Medicare supplements are contracts. They are contracts that you are purchasing from an insurance company. And what's going to happen is Medicare is going to pay 80% of your healthcare bills, meaning Medicare Part A and Part B, they're going to pay 80%. And then you're buying this supplement thing to pay your bills. That's it. You're buying it to pay your bills. They're contracts. It's a great thing about these contracts is that it's contractual, right? You are obligated, the company is obligated to pay certain things, and you are obligated to pay a premium every month for that contract. Now they're standardized by federal law. They are standardized, which is wonderful too, meaning Company A and Company B are selling the exact same Medicare supplement, but the price is different. You might have one carrier paying $100, one carrier paying $200 a month. Now, what if you want to change from carrier A to carrier B? Can you do that without answering medical questions? The answer, unfortunately, is going to be no in most states. In the majority of states out there, you're going to have to answer new questions if you want to go to a new insurance company, which is partially why you need to be really careful when you make that very first choice as you're purchasing that Medicare supplement. Topic for a different segment here, but it is important to get some features down of the insurance company so that you don't want to have to change companies, because if you do, most of you are going to have to go through medical underwriting. It is going to come down to where you live. However, example is New York. New York does not have this issue. So New York, you can go from company to company to company to company and not answer medical questions. We have to answer medical questions in Michigan. Most states, you're going to be asking new questions. And when you think about this, the reason is because the new insurance company, if they know you're going through physical therapy, or they know you have a recent heart condition, or know you had a cancer diagnosis, they're not going to take on that risk because they know what they're going to be paying out. So they have the ability. What also surprises people here is this is not the ACA, Affordable Care Act. So the Affordable Care Act, if you are familiar with that, there is no exclusions for pre-existing conditions, right? Anybody with any medical condition can go get a plan. However, people are very, very surprised to learn that that ends at Medicare age, at a time when most people have some pre-existing condition, right? It's a little bit backwards, but it is the way the rules are. So many, many people will say, well, that's not true because the ACA protects me. It does not protect you with Medicare. Okay, so you need to be careful. You need to understand your state's rules about changing carriers, and you should be careful on your first entree into that first Medicare supplement so you don't even have to worry about changing carriers down the road. Hopefully that helps, and just tune in for other segments on Medicare here on Get Set Up.